Welcome to this is part one of a two-part webinar series called Addressing Vape Product Use on College Campuses, hosted by the New York State Quitline. My name is Tony Astrin. I'm serving as the moderator for both webinars. And I wanted to say first and foremost, we've for a summer webinar, which this is right now, we're very happy. There's more than 150 people registered. Of course, not everybody will be live, but there's definitely going to be quite a wealth of knowledge shared in both webinars. And as we'll mention on the next slide, we are recording this. We'll have resources for all of you afterwards. And the real genesis of these webinars is it really was developed out of need. We have heard more in terms of our surveys, our regular surveys to both licensed healthcare professionals as well as community-based organizations that it's an area of need. People want to know more about it, and even just anecdotally throughout what we hear with our partners in different parts of the states as part of New York State's comprehensive tobacco control program, that this is, again, an area where people want to learn more about it. So we're happy to bring together for both webinars really a diverse lineup of speakers, lots of great knowledge. We're packing quite a bit in, but hopefully you're going to get quite a lot out of this hour. And of course, hope you can join us for part two as well. So again, I'm your moderator, and behind the scenes, Pat Bax is at the controls. So you may see some messages from her in the chat. And if you have any need immediate assistance, feel free to shoot her a message as well. In terms of the housekeeping, as mentioned, this webinar will be recorded. We are asking everybody to remain muted. Being on camera is okay. And though we have the chat box going on, there is a separate function. Hopefully you're seeing this on Microsoft Teams for Q&A. And we encourage, if at all possible, if you can, ask any questions that you have of the presenters in that Q&A box. Long story short, it's a way to really keep that information of those questions separate, contained, and just in case if we do go a little over on time or there's a lot of dialogue and there's questions that we want to get back to after the webinar is complete, we've got it in one central place. But we definitely encourage participation. In the end, we will have 3 different presenters, and then we will do Q&A, a combined Q&A afterwards. Couple quick disclosures. There's no conflicts of interest to declare, no financial benefit. We don't have CMEs, but we do have certificates of attendance if you would like. We will have an email that we send out later on this afternoon with some follow-up in case you misplaced our contact information, but you can do that upon request, and we're happy to get that to you right away if you need documentation for being part of this webinar. And very important, we just want to say again that the term tobacco throughout this webinar refers to the use of manufactured combustible commercial products and vape products, not the sacred, medicinal, and traditional use of tobacco by Native American nations and other indigenous groups. Our presenters for today, the real stars. We're going to begin with Monse Bonsall-Travers. She's director of the Tobacco Outreach Program, among many hats, I should say, here at Roswell Park Comprehensive Cancer Center. We'll then transition into Jennifer Hamilton, who is with Tobacco Free Zone, Cortland Tompkins Chenango, and which is part of Cortland County Health Department. And then wrapping up before Q&A with Brian McGann, Director of Campus Operations for Nazareth University. I'll say for those of you who are planning on being on both part 1 and part 2, you get a little taste, so to speak, of Western and Central New York, and then part 2 definitely moves more into what we call the metro region. So we are getting the state fully covered, but keeping more to the West and Central this time, although what you'll learn definitely can apply throughout all of New York State. Our primary goal for really all of these webinars is we're looking to provide campus administrators, student healthcare center staff with the knowledge and tools to play a critical role in maintaining vape-free environments, promoting resources for students to overcome nicotine addiction. So for this particular webinar, main goals, main objectives, we believe that at the end of this hour, you'll be able to recognize types of vape products, potential health harms, and implement strategies to create and or enforce vape-free college campuses, and then finally identify free resources for college students to overcome nicotine addiction, and lots more, of course. Without further ado, we're going to get into our very first speaker to kick things off, Dr. Monsi Bansal-Travers, and take it away.
Okay. Hi. Thank you so much. I'm really so happy to be here to help kick off this webinar series, and I'm just going to get right into it. This image shows you the current market of tobacco and nicotine products in the US. There are several types of products available, but we're going to focus on e-cigarettes or vapes today. Next slide, please. The product mix is changing. Many products are available and many people use many products. While 17% of youth in New York report using any tobacco product, use of e-cigarettes among youth is highest at 13.1%. Recent data from the New York Youth Tobacco Survey shows that 1 in 6 high school students reported using at least one tobacco or nicotine product in the past 30 days. Next slide, please. Good God. The Nicotine and Tobacco Product Assessment Resource at Roswell Park, and Roswell Park also houses the New York State Quitline, provides comprehensive testing of tobacco and nicotine products to examine the concentrations of nicotine and other chemicals in tobacco and vape products. Researchers collected and analyzed cannabis and nicotine vaping products from 36 schools across Western New York. 1,630 products were collected, so these were confiscated from students and collected for analysis from schools in the 2024-25 school year, and they were analyzed, including many of the products that you see here. Next slide, please. Of the products tested, 79% contained nicotine, and every one of those devices contained nicotine equivalent to between 1 and 22 packs of cigarettes. 21% of vapes analyzed contained other substances, including THC and CBD. Next slide, please. While youth vaping is down in New York, vapes are still the leading product reportedly used by high school students. Next slide, please. And in New York, the 18 to 24-year-old age group, so the age group that we are talking about here with college campuses, reports the highest prevalence of use. Next slide, please. In fact, e-cigarettes are the most commonly used product among youth and young adults across the US. Next slide, please. Now, we know college in particular is a critical transition period for youth and young adults. Brain development continues into the mid-20s. Environments and social structures are changing and independence is increasing. Colleges can also provide a unique and opportune setting for education and resources to help prevent initiation and support quitting. Next slide, please. Oh, yep, thank you. So why do youth and young adults start and continue using nicotine and tobacco products? There are several initiation cues or cues in their environment and social structure that can normalize use and decrease perceptions of harm. This normalization is reinforced by physical experiences, including those experienced with an addiction to nicotine, which then leads to persistent dependence and potentially low confidence in the ability to successfully quit. The key to overcoming this is to change the environment and the social norms around vaping and smoking, to increase education and provide confidence in the ability to quit, and also make quitting support immediate, confidential, and simple. Next slide, please. It's important to remember the environment. Youth and young adults are bombarded with marketing and advertising, much of which conveys a message that nicotine is somehow helpful or beneficial. And the repetition of the claim doesn't make it true, but it does help it stick. Next slide, please. Youth are uniquely susceptible to nicotine addiction. Adolescents' brains continue to develop until around age 25. Youth also show signs of dependence quickly, sometimes before regular or daily use. Studies have shown that most adults who currently use tobacco or nicotine products started as adolescents. Next slide, please. Students often use nicotine thinking it will help with focus and concentration, but they end up dependent and then experience withdrawal symptoms. These symptoms often include stress, difficulty concentrating, anxiety, restlessness that are associated with withdrawal, but they're also associated with nicotine addiction. So they end up using and trying to quit and then having withdrawal and using again to ease the withdrawal. It's a vicious cycle of addiction. Next slide, please. Nicotine has known and potential risks beyond addiction. Nicotine can harm the developing brain, including parts that control learning, memory, and attention. Nicotine can also prime the brain for addiction to other drugs. Acute nicotine exposure at high doses can be toxic, particularly to children, and nicotine withdrawal can cause a temporary increase in depression and anxiety symptoms, which are again side effects of nicotine use in youth. Nicotine also harms multiple body systems apart from the nervous system, including the respiratory, immune, and cardiovascular systems. Next slide, please. Therefore, for adolescents, nicotine dependence can have multiple implications for health and academics, including dependence, health risks, attention and learning, and overall well-being. Next slide, please. There are also social and health equity differences between different populations in both the marketing and use of nicotine and tobacco products, as well as access and availability of cessation support. It is critical that cessation resources identify and act on these barriers to care. Next slide, please. Therefore, a comprehensive strategy is critical to approaching tobacco and vape product use on college campuses. This includes engaging administration, faculty, staff, students, parents, and the community at large to understand and take action to change social norms and policies around tobacco and nicotine use. Next slide, please. This strategy should be evidence-based and designed to lower barriers, connecting students to campus health resources that include physical, mental, and emotional health resources, as well as those available through New York's Department of Health, including the New York State Quitline, to support prevention and cessation of nicotine and tobacco products. Next slide, please. And thank you.
Wonderful. Thank you so much, Monsi. And we know that for some of what you may have just seen may have been a refresher, but we did want to begin this webinar series just to set the tone, remind people of the landscape of what's out there in products, remind about some of the health harms before we go into the nuts and bolts now about creating vape-free college campuses and maintaining vape-free college campuses. And with that, that's where we turn things over to Jennifer Hamilton. Jen is part of the New York State Quitline's CBO, or Community-Based Organizations Task Force. She has decades of experience in tobacco control, much like Monsi, also decades of experience in research. And one acronym that you'll hear later on, which is also how we're connected with Jen, is she is part of ATFC, which stands for Advancing Tobacco-Free Communities. And she'll mention later on that there are what we call grantees, partners in every part of New York State. So she wears many, many hats, but that's how we first came to know her. And as you're about to see, she has a wealth of knowledge, either to help you get started or, of course, to refine perhaps what you already have. With that, I'm going to turn it over to Jen. Take it away.
Great. Thank you, Tony. Can you hear me okay? Great. Okay. Hi, everyone. I'm happy to be here presenting today. My name is Jen Hamilton. I am a senior public health educator, as well as some of the other titles that come along my way. I do work for the Cortland County Health Department. I am the community engagement lead coordinator for the Tobacco Free Zone program, and that covers Cortland, Tompkins, and Shenango counties. As Tony mentioned, our program is funded through the New York State Department of Health, Bureau of Tobacco Control. And I have been working here at Cortland County Health Department for 25 years. This is my 25th year here. And I've been working in tobacco control and prevention for the same number of years. So I'm hoping that some of my experience and length of time here around tobacco control can help others, as I'm still learning as well. Next slide, please. So I'd first like to give a shout out to SUNY Cortland. Partnering with them on their development of their tobacco-free campus policy, they've given me a really strong knowledge base and experience, learning about the process of creating, implementing, and maintaining a pretty strong tobacco and nicotine-free college campus policy. SUNY Cortland was one of the very first New York State college campuses that implemented a complete 100% tobacco-free campus policy, and that was back in 2013. At that time, vaping really wasn't a big thing at that time. But as time went on, we did make modifications to the policy to ensure that vape devices and their use were included. The number of 100% tobacco and nicotine-free policies on college campuses has skyrocketed over the past decade. According to the American Non-Smokers' Rights Foundation, there are more than 2,500 comprehensive smoke and tobacco-free college campus policies in the United States. Next slide. So why are tobacco and nicotine-free college campuses important? So colleges and universities play an important role in helping students, faculty, and staff break free from nicotine addiction. And as Monsi said, nearly all users start well before the age of 25, 26, and vape use typically occurring among the young adults. Colleges are a crucial player in preventing nicotine addiction and reducing vape product use. And besides, most of the students are coming from K through 12 educational institutions that already don't allow tobacco product use on those properties. Next slide. We can't lose sight that tobacco use remains the leading cause of preventable death and disease. These products are a safety and environmental hazard, and I'll talk a little bit more about vape devices in a later slide. Also, tobacco-free campus promotes accessibility for everyone. No one should have to risk exposure to toxic smoke and aerosol. Again, it also sends a strong message that health and addiction-free living is important and taken seriously. It can also reduce maintenance costs associated with cleaning up the litter and also enhancing the campus's image. And lastly, but maybe the most important reason and justification that everyone can get on board with and rally behind is promoting respect, respect for other people and for the campus environment. Next slide. So how might you get started? My strongest piece of advice is to not rush it. Give yourself plenty of time to do this right. I strongly suggest engaging a variety of people from different sectors on campus to enhance the buy-in. Consider including employees from HR, health services, health promotions, coaches, union representatives, students, parents, climate, sustainability, environmental club members, policy or government clubs, your buildings and grounds staff, res life, student affairs, the university police, health and wellness related professors, if you have those types of majors on that campus. And your local health department may be able to help. I wouldn't exclude them. Be sure to welcome and include tobacco users and non-users input. And you can also contact someone like me who works for the ATFC grant that Tony mentioned. Information on how to find who that person is, I'll have at the end of my presentation, so you can go on and look for that person in your county. All counties are covered by this grant. And it's in all of our work plans to work with major employers for outdoor policies. So that would include colleges. It's also very imperative that you get support from the college president and other senior campus administrators. Next slide. So what would you maybe want to do next? Gathering, collecting information is really key to start with. Consider conducting assessments and surveys to understand what's going on your campus. Such surveys that might gauge the level of support from students, faculty, staff, non-users, and users of tobacco and other nicotine products. You may want to collect some data on prevalence of use. Consider observational surveys that include locations of where tobacco litter is on campus, where people are using tobacco, observing if there's exposure, as well as the types of products that have been found to be littered on the campus. And these types of assessments could potentially be done by students who are conducting research project classes, which we did with SUNY Cortland. And Monsi provided some great data from Roswell as well that you could use in some of the justification for moving forward. You'd also want to obtain the existing school policy and gather some other college policies to look at. HR can also investigate employee health insurance coverage for cessation, including the medications and counseling. Student health services staff can report on what the existing resources are for students. And plus, you have the great New York State Quitline handy here as well that have an abundant a number of resources. Next slide. I've also included some concerns around vape waste. So another compelling and motivational factor for colleges and universities to consider taking action is the danger that comes along with vape waste. The most commonly used vaping product is a disposable one, and people regularly discard them as litter, throw them in the trash. The US throws out 5.7 disposable vapes per second. It's becoming a rampant problem. And they shouldn't be tossed out like this because they are toxic and flammable and they could explode. They are identified as electronic waste and acute hazardous waste. The devices include a lithium-ion battery, a heating element made of metal, and concentrated nicotine liquid. The concentrated nicotine liquid is not only incredibly harmful to humans, but also to wildlife and to the planet. Vaping devices do contain recyclable materials, but the amount of metal is just so small. Recycling is very difficult because it really takes some careful dismantling to separate the plastic, the battery, and the liquid. And individuals should not be doing this on their own. Do not attempt to take apart these on their own. I know Roswell will do that, as Monsi mentioned. Facilities that handle this kind of thing are scarce in New York State, and it is quite costly to get rid of them. Facilities that do accept the vape devices in our state, they generally take them to be incinerated, which is also dangerous and destructive for the environment. So yeah, a growing concern here. Next slide. Okay, I'm mentioning it again. Don't rush the process. Don't do it. And I think Brian might also mention this in his presentation, that give yourself draft a timetable. Give yourself some time, plan it out. Give yourself at least 18 months. I would recommend at least 18 months to implement a policy. You want to build and identify your rationale, really build the why behind why you're doing this, and be ready to communicate. Next slide. There it is, communication. Key communication. Educate in as many ways as possible. Emails, website. It has to come from the top down. President's support, president's letters, social media, campus monitors, video screens, any digital means necessary, signage, which our grant, ATFC, can help pay for. We've done coffee sleeves. We've put messages on coffee sleeves, as well as put a QR code to the Quitline for those that are seeking help. Offer and weave in the messaging in already existing activities, particularly when it comes to activities that can help with the emotional, the physical needs of the campus community. Include like a movie night or food-related events or meetings. Make sure that the community, visitors, and vendors, and any other contracted businesses are aware of the policy. You want to integrate it into new student and new employee orientations as well. Next slide. I'll touch on some enforcement and monitoring of the policy. So while various institutions have different enforcement strategies, at SUNY Cortland, we really emphasize the route of a non-punitive enforcement action. Unless there is blatant, repeated disregard of the policy, then it would be elevated to the norm campus violation policies and mechanisms that are built into student code of conduct and staff and faculty disciplinary procedures. But I would say that that had rarely happened at SUNY Cortland. We didn't assign certain individuals or departments with handling of enforcement. The policy stresses that the responsibility for compliance was really on the entire campus community. It was the members of the community, and really driving home the mantra that this policy is driven by respect for other people and respect for the environment. So compliance has been very good being handled this way. I do know that other colleges have put the enforcement responsibility on university police and upper management. But I would also say that as with any new policy, it's important to give people time to adjust, and very important to make sure that the community, the campus community, is well aware of the policy well ahead of time in advance. So you may want to tweak your policy to alleviate whatever issues may arise. At SUNY Cortland, we still have a tobacco and nicotine advisory committee. We continue to meet in the fall and spring semesters on a monthly basis. We review our policy, we take a closer look at any problem areas or things that we want to educate on related to tobacco products. We just want to make sure that we're keeping up with the industry and their ever evolving products. So that's been successful in making sure that we're maintaining the integrity of that policy. Next slide. My last couple of slides here are mentions of some resources that may come in handy if your college, your area is looking at doing something like this. One very helpful resource is the Public Health Law Center. I would highly encourage colleges to look at the model tobacco-free policy that they offer. And so when this slide deck will go out to people, so you'll be able to get that link to be able to go on their website. They have one specific for New York State College and University campuses, as you can see by the screenshot there on the slide. And plus, you can also sign up to receive their newsletters and get some information that way, just like you do with the Quitline when you get their information. Next slide. Just a couple others. Since 2015, the Truth Initiative's Tobacco and Nicotine-Free College Program has offered grants in the past to colleges and universities to support the adoption or implementation of 100% tobacco or nicotine-free campus policies. There have been a number of New York State colleges who have received that funding. Onondaga Community College, Columbia University, SUNY Geneseo, Manhattan College. So based on their website that I looked at the other day, the next application period won't open until January of 2027. And they provide a pretty substantial amount of money that can help with the process of tobacco-free policies. So I would recommend going on there to look at that. And they also have a newsletter you can sign up for so that you can become aware when it does get released. And also, if you're looking to contact someone like me in the Advancing Tobacco-Free Communities Grant, head to this website, tobaccofreenys.org, and right at the top ribbon there is a Contact Us button. Click that, you'll find your county, and typically, just like me, where I have Cortland, Tompkins, and Shenango counties, other grantees like me will also have multiple counties that they cover. And the next slide is my contact information, and I welcome anyone to feel free to reach out to me if you are looking for other resources or some advice. And that's what I have for today.
Fantastic, Jen. Very, very comprehensive. Lots of tools that I think people can go back to. And one thing I'll say, which you mentioned on one of the previous slides about the Public Health Law Center, is they too, just like the New York State Quitline, just like all of ATFC and then other aspects, they are all part of New York State's comprehensive tobacco control program. So there are members from that law center that they are just all completely 100% focused on New York State. And with that link that you'll see in the resources, what the tools that they have available, it is all just completely New York State. Lots of great, helpful, not only to understand what the latest guidelines are, regulations, but just, again, those sample policies in case either you're looking to get started or maybe you'd like to make some tweaks and need some inspiration for where to begin. So thank you very much for that, Jen. And now that Jen set the stage for all the different nuts and bolts to know, now we turn it over to somebody who has lived through the process, is on a campus, and that's where we welcome Brian McGann, who is Director of Campus Operations for Nazareth University. And I'll just say from my own personal perspective here when putting together this webinar, was so happy that he really anybody from their team was free because as I did my research looking at colleges, universities throughout the state, Nazareth, as you'll see later throughout the slides and clicking on links, they have just not only a wealth of materials and they know how to do it best, but they started, as you're going to see momentarily in his slides, very early. So they've really, really been on top of the game. And as you're about to find out, more than started with, of course, traditional combustible cigarettes, and now the policy covers quite a bunch more. But let me not steal his thunder, and I'm going to turn it over to Brian to explain how Nazareth went through their policy and now what is coming up in the future. So, Brian, welcome.
Yes, thank you very much. Happy to be here. Happy to talk about the process that we had. It has been a long road, and we did not rush it, which I think was the right approach. But this is a mature and tested policy. We've been effective since August 1st, 2017. So a couple years behind my alma mater of SUNY Cortland. And then we updated the policy August 1st, 2023, which included marijuana on campus. And that was due to the legalization of marijuana for New York State. Next slide. So just our policy at a glance. As I stated, we started with smoke-free, tobacco-free, and vape-free, and then updated the policy in 2023 to include marijuana. And with these, these all include anything that you can ingest, obviously smoking, eating, chewing, things along those lines. Those are all covered in our policy. So it's covered throughout the entire campus. So anything that is university owned, any of our leased properties, indoors, outdoors, offices, parking lots, we get a lot of questions of, can I smoke in my car? We do ask you to leave campus. So vehicles are part of that policy as well. This is for anyone that is on our campus. So faculty, staff, students, any clients that come on the campus. We have Health and Human Services here, runs a lot of clinics, so we do get a lot of clients on campus. Contractors, visitors, pretty much anyone that enters our campus, this policy is applicable. And why we did it, we're at the forefront, like I said, with a lot of majors in the Health and Human Services realm. So we, thought it was appropriate that if we're going to be teaching our students, that we also want to, walk the walk when it comes to health and wellness. Next slide. So this was a long road. Started back in 2011. I believe at this time, I think a lot of college presidents within New York State started talking about, what are other campuses doing in regards to tobacco free. So at this time, we already had a health and wellness committee. So our president gave a formal charge to the committee to really start looking at tobacco free as a possibility on our campus. So started the conversations. Fall of 2011, our task force was established. In spring of 2012, we sent a campus-wide survey to all our students, faculty, staff, and contract workers. So here at Nazareth, we have a fairly large facility staff that is operated by Sodexo, and our dining is Sodexo as well. And we have Barnes & Noble as our textbook provider. So we wanted to make sure that, as a good partner, that we were including them in the campus-wide survey as well. We made sure, going back to the task force, we did want we kind of put a call out that if you are a current smoker, we would like that voice on the task force as well. Received survey results, which I'll show you in the next slide, and presented that to our full health and wellness committee. Our committee kind of came down to two approaches that we wanted to do. So the first one was, yes, at this time, tobacco and smoking was allowed on our college campus. We had some smoking huts across our campus. We had a policy, you cannot smoke within 20 feet of an exterior door. You can't smoke in the res halls. You can't smoke in buildings. It wasn't overly enforced. And, I think some of our smokers on campus, with the weather that we have here in Rochester, you get closer to the door. Maybe you're sneaking inside to smoke at those times. So we came down to, number one, do we start enforcing the current policy that we have? And then number two, do we work towards a fully tobacco-free campus? So our task force delivered 2 reports to our president at that time. And next slide. So with the campus survey, we found that 11% of our campus population smoked. 90% of them smoked on campus, and 54% of our campus said that they were bothered by secondhand smoke. The surprising number was that only 31% of our campus wanted no smoking on campus at all. We actually got a little bit of feedback from our non-smokers, essentially being like, who are you to tell someone where they can smoke and where they can't smoke? So that was a lot of the feedback that we got within our survey. The majority of people wanted maybe more of an enforcement of our current policy of there's just designated areas where smokers can smoke. But 69% were in favor of smokers still smoking somewhere on our campus. Next slide. So we had all that information. We presented to our campus leadership and president. We got the plan approved. No budget was identified at the time. We had a very inclusive health and wellness and tobacco-free task force. So we had students, faculty, and staff on campus. A lot of our faculty and students are not on campus over the summer, so we took a summer recess, and then for whatever reason, it turned to not be a priority for a couple of years. Whether it was budget constraints or moving forward with the suggestions, we were just kind of on a pause. We were, as a health and wellness committee, happy to see that in March of 2017, it was conveyed to us from leadership that our efforts going to resume. We're going to start putting out in social media, emails, pamphlets, things along those lines, that our campus was going to become tobacco-free as of August 1st, 2017. Within that, we were working with our human resources on cessation programs, making sure that any of our faculty or staff employees had the resources that they needed. We worked with our campus partners in Sodexo and Barnes & Noble to make sure that they had cessation programs within them. We worked with our campus health center to make sure that our students had resources. We started putting up signage. We did receive a grant for that signage, and it was a decent amount of money for us to put signage across our campus. There was just generic signage that is out there, but we were able to customize it to meet the branding of Nazareth. So it kind of you're able to see the signage and, get the message, but fit in with our branding. So the policy takes effect August 1st, 2017. We became smoke, tobacco, vape-free campus, and it was received really well. Our enforcement was that we are a community. It's not punitive. It's more of educating on the policy. We are higher education, so education is really folded into everything that we do. We had a few instances here and there where it's like, hey, just a reminder that this is the policy. We had some leakage off our campus into some neighbors. A reminder, be respectful of our neighbors. You're not to go on our neighbor's property. We ask everyone to go off the campus and leave, and that doesn't mean go stand on our neighbor's property. So it's been, really a community enforcement, and we've had no issues. We did discuss the punitive. It was quickly kind of shot down as that wasn't going to be the way that we were going to go. When we were going through this, we also, brought in some national experts, and really that was the suggestion that they had as far as the enforcement goes. 2023, we updated to include marijuana, and this was, you can go to the next slide. This was due to the legalization of marijuana within New York State. As a university, we are a drug-free campus, so we're always drug-free, but just to make sure that the messaging was not construed for our students as, marijuana was now legal. We added the marijuana into the policy, and like it says here, that goes to really anything that's containing THC, regardless of the method. It doesn't have to be smoked. It could be smokeless, spit, dissolvable, inhaled, eaten, things along those lines. So we updated that. We updated, the website that we have here on campus. We put a campus message out, and we really have had no issues with that updating of the policy. Next slide. So really, I think why we've been successful is it's really that respectful educational approach. We're not punitive. We sometimes have to let someone know, like, hey, this is the policy. This is where you can smoke, which is essentially you need to leave our campus. This is where the policy can be found. This is the information. If you have any questions about a cessation program, those are all things that are ongoing. I would say the biggest conversations that we have are either if we're inviting or we're hosting external events that are on our campus. So making sure that within the contracts that we have with the outside organization, that they know that we're a tobacco, vape-free, marijuana-free campus. Some of they're participants that aren't normally on our campus. We might have to have a conversation with them, or a contractor that's coming to our campus that, maybe is not someone that comes to our campus very often. But other than that, we've had very few even conversations that we've needed to have with our campus community. Next slide. So we do have, as part of our materials for our students, there's resources within health and counseling on our campus, for our employees, through our Excelis on our campus, through EAP, through our campus, for our employees, but that also includes family members of our employees. And then our on-campus contractors such as Sodexo and Barnes & Noble, they have their resources as well that they can go to. Next slide. And then it was a really inclusive process, and it really has made Nazareth a healthier, safer campus for everyone, which is really something that we educate our community on a daily basis. So it was a really good process, and I think the inclusiveness led to the successfulness of the program. And any questions, please feel free to reach out.
Wonderful. Very, very comprehensive as well. We see how the policy gets started and how you live it, how you update it. And in fact, this slide here, people see it afterwards, but where it says link, I did throw it in the chat both to the main page that is very comprehensive and then the actual policy. This is a little snippet that I put here on the page just to give you an idea of some of the language and verbiage, which once again, if for folks who may be looking to either create or update a policy, great resource to use. And with that in mind, before we go into, we do have a couple quick questions in the chat before we end. But Brian, I know, looking at kind of how everything happened and trying to get that support at the top and the go ahead to do things, and you even had that little bit of a hiatus in there. Are there any, like looking back on how it's all gone and now obviously things are going well, any other kinds of best practices or advice that you can share in terms of just, I guess, maintaining that momentum, whether you're developing the plan or trying to update it?
Yeah, so there was a fairly significant gap, where we got everything in place, and then a little bit of a lull there. But I would just make sure that even if there's a pause, as long as that we had, that there's still some things that can be done behind scenes to when you're ready to make that change. That the pause doesn't really just end there. So as you can see, we were able to implement our plan after that long pause, and we already had gathered a lot of that information that we moved forward when we eventually went tobacco, vape, and marijuana free. And then I would say there was a lot of conversation in the beginning, and it was all punitive. Like, how are we going to make sure that this person's not smoking on our campus, and what is the penalty going to be? I think especially for college and university campuses that we are here to educate, that it is an education and that you don't treat it punitively. I think that really made it successful for us, and really honing in on the community, that we're all one community, and let's all be respectful of the policies we have on campus.
Excellent. We're going to do two very quick questions that were posed here in the chat. And the first goes to Jen. Jen, the question here is for SUNY Cortland's tobacco and nicotine-free policy. So they're wondering if that's any product that was smoked or vaped, including cannabis. And if it is, if so, does the name tobacco and nicotine-free convey that all products are covered?
Great questions. I'll answer the first one about cannabis. Cannabis was not included in the current tobacco nicotine free, but listening to Brian, we may want to. I mean, I understand now that federal law restricts currently, since cannabis does fall under the scheduled drug, and it includes any educational institution for usage, possession. So we haven't included cannabis, but it's something I think we'd want to consider at a later time.
Right.
And going on that other part of the question, the terminology, and we've done probably 3 or 4 different revisions, updating of our campus policy to try to make sure that we're inclusive, of the evolving products that are coming out. We did have to go back and include electronic cigarettes. We've also danced around with the terminology around vaping, electronic cigarettes, nicotine delivery devices. We will use the language that people are familiar with, and we do try to do some interchanging of some of the terms. Vaping is pretty much probably the top one that people grasp when it comes to electronic cigarette use. But I would say it for SUNY Cortland, we have had to work on the terminology and the inclusiveness, which can be tricky because of the industry and the different types of products. We're currently now going to be updating it to include synthetic and analogs, which is, a lot of lab-based products now that are coming out that we want to make sure is included in the policy. So it's been tricky. It hasn't been simple. I'll say that.
Semantics are certainly difficult when we put everything under the word tobacco, but people, perhaps to some good arguments can be like, well, is this really tobacco? But it's I think the more we can educate that it really is more comprehensive. I think the more people will understand. So the other question that was in here, and we're about out of time, I'm going to pose it, and then Brian, if it's something that you may be able to answer in the chat, if you know, if you don't know, I will say to the person who posed the question, Dr. Miller, we'll try to research this and find out some information on you, which I think is a good one, for those who use edibles for medicinal reasons, how do you handle that? So Brian, I don't know if you've experienced that at all or have any guidance. Otherwise, again, we can look into that afterwards. Oh, we have you on mute. Hang on one second here. There you go.
Yeah, that's a good question. Our policy does include medicinal marijuana, and I believe that is because of the fact that colleges and universities are drug-free. I could get some more information from our health services on why that was included, but it is included in the policy.
Interesting. All right. Yeah, we'll try to investigate that more for you. Thanks for that question, Dr. Miller. So we're almost at time here. Very quickly, I'm going to just breeze through these rest of the slides. But first and foremost, thank you to all three of our presenters. Just a wealth of information today. And of course, we're here with the New York State Quitline, this is sort of that end of that wheel of support of, okay, here's all the policies. Now, if you need help, where do you go? And the one most important thing I just want to remind people of, if you're not already aware, that one program that the state offers and the Quitline helps administer it is called Drop the Vape. It was just launched, at least from us, helping out with the Quitline administering it in June of 2025. And as you can see here from the slide, free, confidential, text-based, you really can get as much or as little help as you need. It's really tailored. Even though there are pre-programmed messages, it does feel almost like you're talking with a friend and a confidant. We've already had people tell us that it's sort of that extra accountability tool in your pocket to get information and to feel more empowered to try quitting and ideally stay quit. And yeah, as you can see here, some very supportive messages. It goes at your own pace. It's really about building the confidence and thinking about all the different things you go through when thinking about quitting, going through the process, handling cravings. Everything is all there, the whole nine yards. And the biggest thing beyond Drop the Vape is, please, for all of you who are at colleges, and we know we have a number of people from county health departments online, there are a wonderful amount of free resources, whether it's print materials, whether it's sample PowerPoint presentations, newsletter copy, to help get the word out about this program. Just a very brief reminder, of course, the Quitline is much more than just vaping. Most people, of course, continue to access us for help with overcoming cigarettes. But we have, of course, phone. We have our wonderful Quit coaches who offer personalized support to help empower people to quit and stay quit. Of course, free medication, which is always, always very, very popular. We not only have Drop the Vape, we have two other text programs, Learn to Quit NY, which is more comprehensive, and Vivir sin Tobacco es Vida, not only translated to Spanish, but culturally tailored as well. All this will be here on the slides in terms of the New York State Quitline. And there's a lot more, of course, on our website. If you haven't seen it already, sign up on our online newsroom if you're not already receiving our newsletters. But plenty of other great programs. The savings calculator is very popular to see how much you'll save if you quit over time. Referral programs, other FAQs. So we're more than just the place to call if you need help and want some medications. We're a place to get comprehensive resources and tailored support. So with that, I will be sending an email this afternoon that has this link. You don't have to write it down. It will be coming to you momentarily with a quick evaluation. We definitely want to hear feedback, what you thought about this webinar. So you get that this afternoon. And then, of course, we hope many, if not all of you, will come back for part 2. We started talking about the policy today. Well, now how do we transition into actually supporting college students? We're going to start off with a young adult who recently overcame vaping to sort of set the stage of what is it like going through that process. And then Gabriella from Fashion Institute Technology really has a very comprehensive slideshow she's putting together to offer that support. And then we go into a conversation format once again with 2 different people from CUNY colleges to talk about getting that campus-wide support and creating a culture of vape supporting and really living out those that notion of being a vape-free college campus. So please stay tuned for that. Otherwise, I am, again, Tony Astron, part of our marketing and outreach team here at the New York State Quitline. Contact us anytime, and we hope to see you back in a week. Thanks, everybody, for attending, and again, we'll see you soon.